Start. So yesterday you were telling me about nitroglycerin. I think I stopped it here. Uses. Then I told the root and this is the dose chart. So you can see this. This is the adverse effects. I told any vasodilators usually cause headache. So very common dizziness. Cardiovascular may cause hypotension, reflex tachycardia. I told you what is reflex tachycardia. If any drug suppress the SA node, that will not cause reflex tachycardia. Vasodilator plus suppressing the SA node will not cause reflex tachycardia. This drug cause only vasodilation. It is not having any action on SA node. That's why sympathetic stimulation occurs and reflex tachycardia can occur. So that is one of the adverse effects. GIT, nausea, others flushing means more blood flow to the skin. So skin will be reddish, burning under the tongue, and rarely it may cause methemoglobinemia. That is, the oxygen carrying capacity of the hemoglobin can get reduced. So that's why this is one of the adverse effects. So you can remember the pneumonic, headache, episode of low BP, altered heart rate, dizziness, and flushing. So what are the precautions and contraindication? Avoid in these conditions the reason. If the systolic blood pressure is less than 90, risk of cardiovascular collapse because further it lowers the BP. Use of phosphodiesterase 5 inhibitors. That's one of the group of drug that is used for erectile dysfunction. That also cause vasodilation, hypotension. Along with this, there may be life-threatening hypotension. Severe anemia, because this is also called methemoglobinemia. So patient already has anemia, be very careful. In case of raised intracranial pressure, vasodilation may worsen cerebral edema, and glaucoma also you should not use this drug because it may further increase the intraocular pressure. So you have one more drug that is given in your syllabus, sorbitrate, isosorbate, dinitrate. You also have isosorbate, mononitrate. How does this nitroglycerin and sorbitrate differ? The group mechanism, everything is same. Only differs in this point. This can be used in acute angina, but that can be used for prophylaxis or long-term maintenance. Route, sublingual, IV transdermal, oral or sublingual. Onset, once you take the tablet, within 1 to 3 minutes, it starts sublingual, but that is at 60 minutes. And that is little longer acting compared to this. Duration 30 minutes, 4 to 6 hours. Dose 0.3 to 0.6, 5 to 10. So this is a little more potent. Tolerance, rapid with continuous use, moderate. You know what is the meaning of tolerance? What is the meaning of drug tolerance? It's there again in your general pharmacology topic. What is the meaning of tolerance? I tell you. If I give simple example, you will understand easily. Okay. One person. Okay. This person initially, first time, he will drink 15 ml of alcohol. He drank 15 ml of alcohol. He got nice euphoria, alcoholic effect he got. Okay. He continued every day 15 ml for about 1 month. You used to get this euphoria and alcoholic effect, say for example for 4 hours. After 1 month, same person, when he drinks 15 ml of alcohol, is not getting effect. So what you will do, you will increase the dose to 30 ml. When he takes 30 ml, he gets the effect of alcohol, but the duration of alcohol effect is 4 hours only. There is tolerance. After 6 months, to get the 4 hours effect, he may have to drink about 2 bottles. Body is tolerating more the dose, but the effect is same. Understood? So in same way, for this drug, tolerance. After using for few days, the anginal symptoms will not come down. You have to use higher dose because he can tolerate the same thing. But here it is moderate. Then emergency utility, yes, you can use in emergency because it's short acting, rapid acting. Myocardial infarction, hypertension crisis, etc. Even in angina units, but that is a long acting. Here is for maintenance and prophylaxis. So you can't use in acute condition. Next drug falls under calcium channel blockers. Now, actually, this drug is mainly placed under anti-anginal drug. Anti-anginal drug. But this drug also has many other action under CVS only. Mainly it is under anti-anginal, but other place where it is kept is anti-hypertensive and anti-arrhythmic. Anti-hypertensive, anti-arrhythmic. Mainly it is under anti-anginal. Total maybe. Only pertain to this drug, it is going to block channel in two places. Calcium channel in SA node and calcium channel in blood vessel. Once the calcium channel in the SA node is blocked, decrease heart rate, decrease force of contraction, mainly force of contraction. Once it blocks the calcium in the blood vessel, decrease blood pressure. Means this is something to do with the conduction of the impulse. This is something to do with the pressure, blood pressure. It has both the action. Whereas, if you see the drugs under calcium channel blockers, we commonly write like this: CCB, calcium channel blockers. There are three groups are there. Non-dihydropyridine, this is here two drugs, and dihydropyridines. Non-dihydropyridines again are under two class: verapamil, diltiazem. Whereas dihydropyridines we have nifedipine, amlodipine, clinidipine. So many decrees are there here. But the leader of this group is nifedipine. Nifedipine is some emergency drug. I don't know, but that is not given in your syllabus for me to deal. For me, they are given to deal with diltiazem. But I will tell you how it is. Actually, same for all the drugs. And main difference between these two groups are these two and that one. With this non-dihydropyridines, mainly this drug blocks this calcium channel both in SA node and blood vessel. Whereas this drug blocks calcium channel only in the blood vessel but not in the SA node. This drug blocks calcium over both. Now you should tell me by seeing this, which drug will cause reflex tachycardia? The drug this group blocks both. Whereas this blocks only the blood vessel but not SA node. Which drugs cause reflex tachycardia? Which drug? You are this side. He is not first. So among four answer, first three is right. You are wrong. Because SA node is also blocked here. Who is there to transmit the impulse for reflex tachycardia? Here SA node is not blocked. So once you block the alpha receptors or calcium channel blockers, BP falls means suddenly barrel receptor is stimulated, gives stimulus to CNS, simple stimulation, and SA node is blocked, no reflex tachycardia. In this case, SA node is not blocked, so So this drug is going to cause reflex tachycardia. So that's the pharmacology concept you should understand. So if patient already has MI or some other condition with angina, which is acute attack, you should not use this drug. Any of cardiac workload came down. On one hand, other hand, heart rate increase in this case. But this is little safer. Just example I told you. So I have been given to take diltiazem. Actually, sublingual tablet available for emergency condition is your nifedipine. Emergency drug kept under the tongue just like your nitroglycerin. So I have been given to take diltiazem, just coming as a non-dihydropiridine that blocks both this action. That's all action. Calcium channel blockers blocks the calcium channel on the SC node also and blood vessel also. That's action. That's all. So where it belongs, you can see the drug class calcium channel blockers, subclass non-dihydropyridines, category antianginal, antihypertensive, class 4 antiarrhythmic. There are 4 classes of antiarrhythmic. It belongs to last one, class 4. I'll tell later when arrhythmia. Action site, mainly action on the heart, that is SCA node and the blood vessels. It will not cause reflex tachycardia. So you can see there. Diltiazem blocks L type of calcium. There are 3 types of calcium channels. LTN, 3 types of calcium. L means long lasting. T means transient. N means neuronal. This is present in the neuron. This is present in the CNS. This is L. This is present in the SC node and blood vessels. So it blocks the L type of calcium channels. SC node, AV node, decrease heart rate, decrease mitral contractility, blood vessels, decrease blood resistance, and decrease blood pressure. Simple action. Okay. So this drug will cause reflex tachycardia or not? Yes or no? This drug will cause reflex tachycardia. Yes or no? No. So it's safe or not? Safe. Indication: hypertension. Yes. Reduce BP. Angina. Yes. Stable variant. Oxygen demand reduced. Vasopressin also gets reduced. And these 3, especially these 2, comes under arrhythmia. That means because it is blocking the SA node, increase in the heart rate gets reduced. See, what is the normal heart rate? Physiology. Normal heart rate per minute 70, 72 per minute. This is on an average. Can't exactly fix it. 70 to 80 or 70 to 80. Suppose if the heart rate comes less than this, is called as bradycardia. If it goes more than this, called as tachycardia. Now you heard bradycardia, tachycardia. Have you heard bradyarrhythmia and tachyarrhythmia? What is bradyarrhythmia? The rate is less, rhythm is also improperly less. Rhythm is what? At the gap of proper interval, the beat should come. That is normal rhythm. For 70 it should be like this: 0.2 second, 0.2 second, 0.2 second, 0.2 second, 0.2. If it comes like this, normal rhythm. Sometimes what happens? 0.2 second, delay, 0.2 second, delay, 0.2 second, delay. Overall, it's coming less than 72. Bradyarrhythmia. Tachyarrhythmia. 0 point like this. Going more than 72, rhythm also lost. Like it comes. Tachyarrhythmia. The same way, lots of other arrhythmias are there. But these 2 comes under increase in the beat. To reduce the beat, so block the SC node. That's why the calcium channel blockers are used. Understood? How the rhythm is reduced. Then coronary disease improves mitral perfusion. There also you can use this drug. What is emergency use? Fast. For fibrillation and atrial flutter, rapid rate control, you can use this diltiazem. Angina, you know that, emergency. Supraventricular tachycardia is one more arrhythmia. Supraventricular is what? Atria, above the ventricle. Atria. So paroxysmal and tachyarrhythmia. The QRS complex is narrow. Then also you can use this calcium channel, especially diltiazem. One more drug, as I told, belongs to the same group, verapamil. Everything is same. From action to use, everything is same. The drug is different, verapamil, and this is diltiazem. Come to dose, IV bolus, IV infusion, and oral also is available. These are the indication. Fib is fibrillation, atrial fibrillation. You find out from your Google what is the meaning of all these terms. PSVT, atrial flutter, atrial fibrillation, ventricular tachycardia, okay, and TORSAD, toss these points. Toss it is these points. Find out them. Toss is the points. TORS. In fact, it will give you the spelling. No, don't worry. Writing too much big, so spelling will not come there properly. Toss it is this point. These are some of the type of arrhythmia. Also, one more is called as WPW syndrome. Wolff-Parkinson-White syndrome. These are coming under arrhythmia. Come to adverse effects. Serious, it may cause bradycardia. You can remember the blocks. Just remember the names enough. Blocks. Bradycardia, low BP, edema, constipation. Not in the limits, AV block can occur if you use with an overdose. The conduction completely can stop and heart can get arrest. Then spinning, dizziness. You feel, because all the alpha blockers and calcium channel blockers cause dizzy because rapid flow of the blood to the lower limbs. So with this about those drugs yesterday, because remained, I just completed.